Edutainment Studios welcomes you to Autism Spectrum Disorder, Beginning to Understand. This module is part 1 of a 9-part series. Autism is not just a single disorder, but is actually a spectrum of closely related disorders that have a shared core of symptoms. Every individual on the autism spectrum has some degree of difficulty with social interaction, empathy, communication, and flexible behavior. However, the level of disability and the combination of symptoms varies tremendously from person to person. In this course, the objective is to help you understand the basic information about autism spectrum disorder and to learn the symptoms of ASD that are associated with social interaction. Autism spectrum disorder is also called ASD and is a condition that is related to the way a brain develops. ASD affects how a person communicates and learns, as well as how they act and interact with others. The term spectrum refers to a wide range of symptoms and the severity of the condition. Autism spectrum disorder now includes conditions that were previously thought to be separate illnesses. These conditions include autism, Asperger's syndrome, childhood disintegrative disorder, and an unspecified form of pervasive developmental disorder. ASD begins in early childhood and eventually causes issues with someone functioning normally in society. Children often show symptoms of autism within their first year of life. ASD is a developmental disability that is caused by abnormalities in the brain. The exact cause of these abnormal differences is not yet known. However, some studies of people with ASD have shown a difference in their genetic condition. Someone with ASD may communicate, interact, behave, and learn in ways that are different from the average person. Their learning, thinking, and problem-solving abilities can range from gifted to severely challenged. Some people with ASD need a lot of assistance with daily activities, while others need much less and can function on their own. Some children show signs in their early infancy stage. These signs can include reduced eye contact, lack of response to their name, or an indifference to caregivers. Other children may develop normally for the first few months or even years of their life, but then suddenly become withdrawn, aggressive, or even lose language skills that they had already acquired. Signs are usually noticed by the time they are 2 years of age. Each child with autism spectrum disorder will have a unique pattern of behavior and level of severity, ranging from low to high functioning. Some children with ASD just have difficulty learning, while others show signs of lower than normal intelligence. Some children with the disorder have normal to high intelligence, yet have trouble communicating and applying what they know to everyday life. Adjusting to social situations can also be a frustrating struggle for them. Because each child has a unique mixture of symptoms, the severity of each case can sometimes be difficult to determine. It is generally based on the level of impairments and how they impact one's ability to function. It is important to note that people without ASD can also demonstrate some of these symptoms, but for someone with ASD, the impairments can make life very challenging. Social issues are one of the most common symptoms throughout all the different types of ASD. These social issues that develop can cause serious problems in the patient's everyday life and can include not responding to their name by 12 months of age, avoiding eye contact, preferring to play alone, not sharing interests with others, only interacting to achieve a desired goal, having flat or inappropriate facial expressions, not understanding personal space boundaries, avoiding or resisting physical contact, not feeling comforted by others during times of distress, struggling to talk about their own feelings, having trouble understanding other people's feelings. By the time they reach their first birthday, a typical toddler interacts with others by looking people in the eye, copying words and actions, and using simple gestures such as clapping and waving. Most toddlers show interest in social games like peekaboo, but a young child with an ASD might have a very hard time interacting in such ways. Some people with ASD do not show an interest in other people at all, while others show a desire to have friends but do not understand how to develop a friendship. Many children with this disorder have a very hard time understanding the concept of taking turns and sharing, which can make other children not want to play with them. It is difficult for someone with ASD to express or talk about their feelings while also having trouble understanding how other people feel. Many are sensitive to being touched and might not want to be held or cuddled with. Self-stimulatory behaviors like flapping arms up and down over and over are common among these cases. Anxiety and depression can also affect someone with ASD. All of these symptoms and challenges can make social problems even harder to manage. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for Part 1 of 9 on Autism Spectrum Disorder, and please join us for Part 2.